How do health and social care settings manage sensitive information? This video explores the essential practices and legal frameworks involved in handling information. Discover the balance between confidentiality, security, and accessibility. This unit aims to address confidentiality and ethical practice in information storage and use. It emphasizes the skills needed for good practice in recording and sharing information. Storing and accessing information are also key focuses. The goal is to promote secure and ethical handling of data. These practices ensure compliance with legal standards. Legislation like the Data Protection Act and GDPR governs data handling. These laws ensure fair and transparent processing of personal data. The Freedom of Information Act grants access to certain public data. The Health and Social Care Act focuses on secure information sharing. These laws form the backbone of data management in care settings. Confidentiality is a core principle, limiting access to those involved in care. Information must remain accurate and up to date. Security measures include both physical and digital protections. Accountability is crucial, with staff responsible for the data they manage. Breaches can lead to serious consequences. Organizations implement policies aligned with legislation. Information governance frameworks define staff responsibilities. Confidentiality agreements are standard practice. Data retention policies ensure records are not kept unnecessarily. Training programs help staff understand their duties. Service users have rights concerning their data. They can know how their data is used and access their records. Users can request corrections to inaccuracies. Consent withdrawal is possible in some cases. These rights empower individuals in managing their information. Daily practice involves accurate record keeping in care plans. Information is shared securely with relevant professionals. Breaches, like discussing details publicly, must be avoided. Secure IT systems are essential, with access restricted to a need-to-know basis. These measures protect both users and providers. The Data Protection Act governs personal data collection and use. It ensures data is processed lawfully and securely. Care staff must store records securely and limit access. The Act protects service users' information from misuse. Compliance is essential for legal operation. This Act allows public access to certain information. Health organizations must respond to requests while protecting patient data. Exemptions apply to sensitive information. The Act promotes transparency in public services. It balances openness with confidentiality. This Act mandates secure information sharing for better care. It facilitates safe exchange of patient records among providers. Confidentiality remains a priority in all exchanges. The Act aims to improve care quality through effective data use. Legal compliance ensures coordinated healthcare delivery. Common law requires confidentiality of shared information. Disclosure is restricted without consent or legal justification. Staff must avoid public discussions of patient details. Exceptions include safeguarding and legal obligations. This duty maintains trust between users and professionals. Article 8 of this Act protects privacy and family life. It reinforces confidentiality in data handling. Care providers must respect these rights in their operations. Users' personal and medical data require careful management. The Act supports privacy in health and social care. These principles guide the use of patient information. They emphasize necessity and proportionality in data access. Accountability is key in handling health records. Staff must justify data access and limit it appropriately. The principles support confidentiality and security. The CQC sets standards for record keeping and data protection. Providers must ensure accurate and secure records. Compliance is checked during inspections. These regulations promote safe information handling. They ensure quality in health and social care services. This code provides guidance on patient information protection. NHS staff must follow procedures for confidentiality. Secure information sharing is a priority. The code helps maintain professional standards and trust. It is essential for effective healthcare delivery. Legal requirements ensure data is processed fairly and securely. Care staff must store records safely and limit access. The law protects service users' information from misuse. Compliance is crucial for legal operation in care settings. It supports ethical data management. In practice, legal requirements guide record storage and access. Staff must avoid public discussions of patient details. Secure information sharing is essential for coordinated care. Compliance ensures trust and quality in healthcare services. These practices align with ethical standards. Accountability is crucial in handling sensitive information. Staff must take responsibility for data security. Breaches can lead to serious repercussions. Training programs support staff in understanding their duties. Accountability ensures trust and compliance in care settings. Training programs enhance staff understanding of data handling. Awareness of legal requirements is emphasized. Staff learn to manage information securely and ethically. These programs support compliance and quality care. Continuous education is vital for effective data management. In conclusion, effective handling of information in health and social care settings is essential for ensuring high-quality care, maintaining confidentiality, and protecting the rights of individuals. Understanding the legal, ethical, and organizational requirements surrounding information management allows professionals to handle data responsibly and securely. Compliance with policies such as the Data Protection Act and adherence to principles of confidentiality not only safeguard sensitive information, but also foster trust between service users and care providers. Ultimately, good information handling practices support better communication, informed decision-making, and the overall integrity of health and social care services. If you have any questions, please feel free to email or WhatsApp us. Thank you.